Hello everyone, my name is Grace Rowe. Thank you so much for joining us for another information video about COVID-19. In today's video, the New South Wales Chief Health Officer, Dr Kerry Chant, will be answering questions about how we can continue to stay safe during the COVID-19 pandemic, and particularly within the upcoming summer months. All of the questions being asked today have been put forward by young people in New South Wales. Thank you so much, Dr Chant, for joining us today. So firstly, Dr Chant, with summer right around the corner, we're able to start doing more of the things that we love, like going to the beach or getting outdoors. What are the most important things that young people need to remember in order to stay safe?
I think you really point out a really important message for going forward. Outdoor spaces are much safer than indoor. So if you can arrange for social gatherings to be at beaches, parks, gravitate towards the outdoor environment, that's the safest. But the messages are very much the same. Don't go out with your friends if you're feeling unwell. Even if you've got that itchy, scratchy throat, feeling a little bit of a runny nose, get tested. And I know it's a big ask, but please do so. It's really important at this time because young people are also being drawn together with older people in a number of festive functions. And so it's really critical that young people take care of their own health and others by getting tested.
And so why is it being recommended that we organise catch-ups with family or friends outdoors?
We know that outdoors dissipates the virus or spreads the virus very quickly. And so in outdoor environments, or the next best is really well ventilated indoor environments, we don't have the virus hanging around in the air, and therefore people aren't able to breathe it in and can acquire the infection. So we know for that. And look, UV light and other things may have a role, but it's that dispersion factor that gives us that added degree of protection. We still recommend people, have that good hand hygiene, try and keep the social distancing, minimise the hugs and the close contact, but outdoors settings provide very much lower risk.
And will we be able to celebrate New Year's Eve and other special events with family and friends this year?
Those events and festivities are incredibly important, as are many other cultural events. What we're keen to do is work with the community and issue guidance about some of the ways in which you can keep those events as safe as possible. And they're basically the same messages we've been saying all the time. If you're going to have a catch up, try and pick events that are settings that are outside. If you're going to a restaurant, please try and take advantage of outdoor seated areas. Make sure you don't go if you're feeling sick, even if you think, oh my goodness, I haven't caught up with X for such a long time. Please just stay at home. Everyone will understand. Get tested, have that good hand hygiene, and maintain that social distancing. Minimise the amount of hugs and kisses and close contact, even though we know that it's such a time of year where we like to show our affection for others.
Dr Chant, as you would understand, young people want to do what is right and keep both themselves and those they love safe. Many young people are worried about their grandparents or elderly family members getting COVID-19. So with the festive season approaching, what advice would you give to us in order to keep our most vulnerable family members safe?
Again, I know this sounds incredibly repetitious, but it's the same thing. If you've got any symptoms, however mild, it's very important for you to get tested. We know the disease is milder in young people, but when you pass on that infection, it can have tragic consequences for older people. And we also don't want to underestimate that occasionally young people will also have a very severe course. So just those common sense messages of getting tested, staying isolated, not going to that event if you're unwell till you've got a negative COVID test. When you're at events, limit the sort of social interactions that you have that's appropriate for the setting. So just reflect your love and caring in ways that perhaps minimise that contact. And that will be a call for everyone individually. But particularly, protect the elderly.
We know that there was a big focus on testing at the beginning of this pandemic, especially when the number of confirmed cases was much higher. So why are we still being asked to get tested and retested if the cases in New South Wales are so low?
That's an incredibly good question, and it's a message that we probably have to get out in a better way. So the reason we want to find every case is that if we start off into the festive season with either no transmission or as low as possibly achievable, it means that it gives us a lot more confidence with allowing and permitting some of the events to happen that are so important to people. Get-togethers, carols in the park, festivities for New Year's, because ultimately the risk of an event spreading COVID depends on whether anyone infectious attends that event. And then the next indication is what behaviours and actions and interactions people have at the event. So we're trying to keep the number of cases in the community as low as possible. The other thing that even though you're hearing one case, every single case causes me great concern, because behind every case may be many more. And what you've seen recently is sometimes when we've detected one case, it has actually meant that there's been a chain of transmission in that community occurring for many weeks prior to that case. And there have been many cases both upstream of that case and then subsequent transmissions. If we did not recognise those cases, block those chains of transmission, then we could end up with quite a large number of cases in the community, which could mean that we have to reintroduce restrictions and other tools to control the spread. So it's sort of counterintuitive, but my key message is every single case might represent and reflect many other cases beneath it. And at the moment, we are trying to get down to no community transmission, which means we have to seek and destroy every little ember of COVID that may be resting.
Recently, cafes and restaurants have been linked to COVID cases. How can we still attend our favourite cafes but remain COVID safe?
Again, a fantastic question. And I would say that young people need to vote with their feet. Seek out those restaurants and cafes that have well-ventilated, non-crowded premises. Choose outdoor environments where possible for your get-together, particularly if a larger group is getting together and you're going to be a little bit more boisterous. Also, make sure you do your check-in so that if we've got any transmission there, we can contact you really rapidly. Make sure you notice that they ask you to wash your hands before you sit down. So businesses that have got those very visible COVID safety practices in place, that they've got adequate distance between the chairs, they're not packing you in like sardines, that reflects a business that's taking their responsibilities seriously. And I would, as a young person, seek out those types of businesses.
Around this time of year, many young people would typically be planning summer holidays with friends or families, and I think one of the most frustrating things for young people has been not being able to travel. Do you think this is something that we can look forward to in 2021?
So in terms of domestic travel, it's pleasing to see New South Wales has its borders open to all states and territories from the 23rd of November. So the Premier has announced that we're opening the border to Victoria, which will really facilitate the family reunions and connections. And I know there are strong connections and always have been with our residents of Victoria. In terms of international travel, I don't want to be a downer at this time, but I think international travel will be a little bit beyond. I think all of us are looking forward. You know, Australia is a nation of travellers, but realistically, I wouldn't be putting too much store in us travelling widely beyond 2022, in 2022.
And a vaccine for COVID-19 has been on many people's minds. How close are we to having one for COVID-19, and would it be available to everyone?
So there's incredible work going on to have a vaccine developed, and there's many novel ways of making the vaccine. We're in the final stages of some vaccines going through the final studies to look at how effective and safe they are. After that, there's sort of regulatory review and checking of all of the data, and usually a period after the vaccine studies close where we continue to monitor people in those studies. We have a long track record of making sure that vaccines are safe and effective before we roll them out. That work's happening. We're also manufacturing a number of vaccines in Australia, and the Commonwealth Government has announced the fact that it's pre-purchased a number of vaccines. And what's interesting is around the world, we're manufacturing these vaccines even before we have all of the efficacy data, how effective they are. It's likely that we may have some vaccines, access to small quantities of vaccines, that is pending all of the positive results from all of these processes, in the first quarter of 2021, but it will be potentially a small amount of vaccine. And then progressively, as vaccine trials results come in and other vaccines are added to the approved list, we will be rolling out vaccines more broadly.
Thank you so much for your time today, Dr. Chant. It is important to listen to information from reliable sources. If you would like more information about the COVID-19 virus, please visit the New South Wales Government website at www.nsw.gov.au. If you feel unwell, it is important to speak with someone and contact Health Direct or a registered GP for advice. It is normal to feel anxious or upset by COVID-19, and if you feel you have been affected by the contents of this video in any way and would like to speak with someone who can help you through these uncertain times, please contact one of the organisations appearing on screen now. Thank you so much for watching today's video, and thank you once again to Dr. Chant for answering our questions.